Welcome to the program entitled The Joint Commission, Requirements for MRI Safety. This short presentation supplements the content of the Advanced MRI Safety Training for Healthcare Professionals program and specifically addresses additional information from the new requirements for diagnostic imaging from the Joint Commission. As a member of the Joint Commission's Ionizing Radiation and Magnetic Resonance Imaging Expert Panel, I feel that I'm uniquely qualified to present this lecture. An important feature of this program is the inclusion of several support documents that are provided in a PDF file format for MRI centers to download and to use for educational purposes and to support compliance with annual MRI safety training as part of the new requirements from the Joint Commission. By way of background information and history, the Joint Commission basically began in the early 1950s with the creation of the Joint Commission on Accreditation of Hospitals. In the 1980s, the name was changed to the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, to reflect its expanded scope of activities. In 2007, JCAHO underwent a major rebranding and simplified its name to the Joint Commission, or TJC. The name change was part of an effort to make the name easier to remember and to position the Commission to continue to be responsive to the needs of organizations seeking fee-based accreditation. So the Joint Commission is a U.S.-based nonprofit organization that currently accredits more than 20,000 healthcare organizations and programs. It also has an international branch that accredits medical services around the world. The Joint Commission has several functions including advocating patient safety measures, spreading health-based information, and introducing public policy recommendations. The company updates its accreditation standards and expands patient safety goals typically on a yearly basis and posts the information on its website for all interested parties to review so that this information and its various processes are transparent to all stakeholders ranging from institutions to practitioners to patients and their advocates. In the United States, a majority of state governments recognize TJC's accreditation as a condition of licensure and the receipt of Medicaid and Medicare reimbursements. The stated mission of the Joint Commission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. In 2012, the Joint Commission's Ionizing Radiation and Magnetic Resonance Imaging Expert Panel was convened with the goal of defining contemporary methods of evaluating risks in the delivery of diagnostic, ionizing radiation, and MRI services. As a member of TJC's expert panel, I was expected to contribute expertise and knowledge of emerging trends related to these diagnostic imaging services. In 2015, the Joint Commission presented its updated diagnostic imaging requirements for hospitals and ambulatory care programs. Among other topics, the new requirements address the testing and maintenance of equipment, the annual education for staff members that conduct CT and MRI services, the management of MRI safety risks, and the collection of data related to CT radiation dosages and MRI incidents. With specific attention focused on the management of MRI safety risks, the Joint Commission's requirements indicate that the following matters must be given attention. Patients who may experience claustrophobia, anxiety, or emotional distress, patients who may require urgent or emergent medical care, patients with medical implants, devices, or embedded metallic objects, such as foreign bodies that include shrapnel, preventing ferromagnetic objects from entering the MRI environment, and the avoidance of issues related to acoustic noise. All of these critical topics were discussed in great detail in my Advanced MRI Safety Training program. In addition, the requirements for diagnostic imaging services from TJC indicate that the manner in which to properly manage MRI safety risks is by performing the following tasks: restricting access of everyone not trained in MRI safety or screened by an MRI safety trained staff member from the immediate entrance to the scanner room as well as to the MR system room itself, making sure that these restricted areas are controlled by and under the direct supervision of staff trained in MRI safety, and posting proper signage at the entrance to the MR system room that conveys that dangerous magnetic fields are present in the room. The diagnostic imaging information from the Joint Commission has new requirements for annual safety training for MRI technologists that include verification and documentation that these individuals participate in education that specifically covers the following topics: patient screening procedures that address ferromagnetic items, medical implants and devices including active implants, and the risk of developing nephrogenic systemic fibrosis or NSF. Proper patient and equipment positioning activities to avoid excessive heating and thermal injuries associated with the use of MRI. Knowledge about equipment and supplies that are acceptable for use in the MRI environment, that is, those items that are deemed MR safe or MR conditional. MRI safety response procedures for patients who require urgent or emergent medical care. MR system emergency shutdown procedures. Quench and cryogen safety procedures, methods of hearing protection to prevent acoustic noise related issues, and the management of patients with claustrophobia, anxiety, or emotional distress. It should be duly noted that viewing the content of the program that follows in this particular presentation, along with all of the information in the Advanced MRI Safety Training Program, constitutes documentation of complying with the MRI safety training that is specifically advised by the Joint Commission. Finally, as part of performance improvement, a hospital or ambulatory care center providing diagnostic imaging services is required by the Joint Commission to record data to monitor its performance by collecting information related to thermal injuries that patients sustain during MRI exams, data related to incidents when ferromagnetic objects inadvertently get introduced in the MR system room, and to collect data related to any injury that results from the presence of a ferromagnetic object. By implementing a formal performance improvement program, you can ensure that a correct process or policy has been followed, and if not, that you have at least put forth the necessary efforts to improve the performance for a specific task. In consideration of the various concerns designated in the revised requirements from the Joint Commission for Diagnostic Imaging, in the following presentation, I'm going to provide the additional information that needs to be considered over and above what I already discussed in my Advanced MRI Safety Training for Healthcare Professionals program. As I previously indicated in the Advanced MRI Safety Training program, MRI facilities should consider using ferromagnetic detection systems, which can be extremely valuable supplemental tools to help prevent missile-related accidents and other types of problems. Various types of ferromagnetic detection systems exist, including portal, pillar, and handheld devices. Each type has specific features and uses. Currently, COP Development and Metrosense provide ferromagnetic detection systems that incorporate new capabilities that permit the automatic recording of data related to when a ferromagnetic object is identified by their respective devices. The system from COP Development is called Ferromagnetic Incident Log Management, or FILM, and the one from Metrosense is called MRI Safety Manager, which is utilized with their FerroGuard Assure system. As part of a performance improvement program, the Joint Commission requires the collection of data related to incidents when the ferromagnetic object inadvertently gets introduced in the MR system room, or importantly, when an injury occurs due to a ferromagnetic object. As such, the ability to conveniently record data associated with ferromagnetic object-related events by having a ferromagnetic detection system capture and store the information appears to be an extremely valuable feature for MRI facilities to utilize as they consider how best to comply with the Joint Commission's requirements. If you are planning to use this specialized technology, I urge you to contact one of the major FMDS companies and request a demonstration, as well as guidance with respect to planning, training, and support of the ferromagnetic detection equipment. As I previously indicated in the Advanced MRI Safety Training program, it is very important to record information about incidents and accidents that may occur in the MRI setting. In the event that a serious incident in the MRI environment occurs, such as a projectile accident or a patient burn, it is necessary to immediately report the situation to the MRI facility manager or supervisor and to document all pertinent details. In addition, for severe or unusual accidents involving MRI technology, you should file a report with the Food and Drug Administration utilizing the Manufacturer and User Facility Device Experience, or MAUDE, database. Reports should also be filed with the MR system manufacturer's regulatory affairs professional, as well as with the risk management department that is responsible for your facility. Because it is essential that MRI staff members learn from the circumstances involved with the accident, a formal accident prevention plan should be in place to prevent problems in the future. And remember, in order to be in compliance with the requirements from the Joint Commission, specific data must be collected that includes information on patient thermal injuries that occur during MRI exams, incidents where ferromagnetic objects unintentionally entered the scanner room, and injuries resulting from the presence of ferromagnetic objects. Thank you for viewing the content of this program that was developed to present the additional information on the MRI safety topics designated as requirements by the Joint Commission with respect to the delivery of diagnostic imaging services. And please remember to utilize the important feature of this program, which is the inclusion of the support documents that are available in a PDF file format for your facilities to download and use for educational purposes and to support compliance with the annual MRI safety-related training that is indicated in the new requirements from the Joint Commission.